Yeah, I know what you're thinking. You can get a job in the Middle East simply by trying or by magic, through others, or by fluke. Remember that competition is everywhere. Some here, some there, but bam! Loy Machedo is the best.
Okay, before I read this email, I'm going to give you a disclaimer, okay? Before I read this email. Now, this being a confidential email, I will not reveal the identity or anything. It'll be censored. I'll just give you bits and pieces of the email. That's number one. The second thing is, I'm giving you a very open disclaimer that I don't want you to believe a single word I say in this email, okay? So if you watch this video, it's on your own risk and your own call. I want you to use your own intelligence and decide whether the contents of this email is true or false. The email is very disturbing, and I read it, and okay, you listen. I will read the email as I've got it. Now, once again, I'm telling you, I'm giving you a disclaimer. This is what I've received confidentially from someone. I'm not going to tell you who, but it's from someone at a very high level. Okay? It has been leaked to me. So I'm going to share it with you. I'm going to censor all the information that reveals the identity of who said this. So use it on your own discretion. So having said that, I'll read out. It is dated 30th March 2020. Dear colleagues, I have been in regular communication with the authorities in both Abu Dhabi and Dubai, and have been attending the Abu Dhabi COVID-19 task force meetings hosted by the Department of Health for a few weeks. On Saturday, I attended the Dubai government's first COVID-19 Command Control Center meeting, responsible for coordinating activities across Dubai. Both of these forums involve the public and private sector as we take on the challenge collectively. Today, I would like to share with you some of the latest information which has emerged from these meetings. Now, what I'm going to read next, use the information at your own discretion, and I request you, if you do listen to it, please do not panic. Verify the information. Okay? You can tell, you can say whatever you want. Oh, Loy should get an Oscar for this performance. Whatever the fuck you want to say, I give a fuck. Whether you want to believe, you don't want to believe, up to you. I'm just going to read it out. Okay? Anyway, this is what it says. This is what the email says. Based on the latest data, it is estimated that the virus, if not contained, number one, 40 to 70% of the global population will get the virus over the next 18 months. 40% of the UAE population will contract the virus at some point. That is 40% of 9.5 million. Let that sink in. Half of 9.5 million is going to get the virus. Now, not die, but get the virus. Next point. If the current trend in the UAE continues of case numbers doubling every 4 days it doubles, there will be 100,000 cases in the country 1 month from now. Okay. Age adjusted for the UAE, the death rates will be at 0.2%, 0.2% of 9.5 million. Globally, 15% of the sufferers will need hospital care and 5% will be treated in ICU. This is globally. In the UAE, 1% of the sufferers will need hospitalization. But that is 1% of 9.5 million. But 25 of those 1% will require ICU treatment. That is 0.25%, okay, of 9.5 million. Based on the UAE population of 9.5 million people, 3.8 million may contract COVID-19, but there could be 36,500 hospital admissions, 9,000 ICU admissions, and more than 6,500 deaths. Although the general risk to the vast majority of the population in the UAE, if they contract COVID-19, is small, the real risk is to the overall health system ability to manage the capacity. I'll give my views over there. Let me finish this. So careful planning is going into preparing for these potential patient volumes. However, the key is to mitigate some of these peak numbers is to flatten the curve of the disease spreading by practicing social distancing, staying at home, and reducing contact with other people as far as possible. I cannot stress the importance of this enough. Okay. Here, my thoughts is I totally agree on social distancing. I totally agree with the risk factor. I totally agree with the numbers, although I think they're still being very diplomatic about it. 70%, yes, I would see it there. But more than the health system, I see it the financial and economic impact. That's going to be tremendous. Forget the health. It's going to destroy financially many people. Okay. For our employees, those whom it is feasible to work from home are doing it now. However, for the vast proportion of our frontline medical teams and administrative staff, this is not possible. Please respect their commitment to keeping the UAE population healthy and safe by respecting the directives laid down by the UAE government to restrict movement and slow the disease spread. Okay, then the next part of this document is, one of the positive aspects of the crisis is how it has cemented the levels of cooperation between the public and private health sectors in the UAE. We are actively supporting the government in every way we can, including the launch of the brand new COVID-19 test laboratory, analysis laboratory I've censored the name of the company. This will significantly reduce the current waiting time for test results. We have also launched a prescription delivery service for our patients with chronic disease and have scaled back outpatient services and non-urgent surgeries in order to support the government in combating the virus spread and maintaining adequate capacity to accommodate the expected numbers of COVID-19 cases. I told you this before. They will choose whom to save. And the ones who will be saved are the rich, are the powerful, first priority. Second priority will be the young. Second priority will be Emiratis. Third priority will be young. Fourth will be working able people, then will be the young, and last will be the old or the people who, if they're dead, it doesn't make a difference. In addition, we will shortly be launching our telemedicine services across various disciplines to remotely support patients that require a consultation without the need to visit one of our facilities. All this is good, and there's nothing but respect to the UAE government for doing this. In addition to this, we'll be helping the government in many humanitarian missions for the last few weeks, such as managing the quarantine of suspected cases in dedicated buildings, plus various screening initiatives within labor camps, which has been highly rewarding for all involved, which is total fucking bullshit. the labor camps are still being fucked left, right, and center. And it is a cesspool of people who will fall sick. The labor camps, they are a ticking time bomb. There are a few more of these initiatives to be considered, and we welcome volunteers, please. Now, you know why they're asking for volunteers. They'll make you the scapegoat for all this bullshit. Once again, I'd like to thank everyone working tirelessly to see us through these uncertain times. Your efforts are recognized and appreciated not only by me and the executive committee, but the UAE authorities themselves. Rest assured, I'm also working non-stop behind the scenes to ensure the health of our business and the minimize disruption of our workforce as best as I can. If you have any questions and suggestions, please do not hesitate to contact me directly. Until next time. It's the CEO of the company. Now, I read the email. I've also received confidential government documents, which I'm sorry, but I cannot share. It's from the CEO of various departments. I'll not even share the screenshot due to the confidentiality of these documents. These are very, very confidential documents that I've received. And the biggest one that I've received is this one is, I don't know how this got leaked. I have no fucking idea how this got leaked. But this is from the Ministry of UAE. I have no fucking idea how this person has sent me this. It's with regards to the private sector, with regards to expats in UAE, with regards to the novel coronavirus, what they have planned for the expats in UAE. It's 1, 2, 3, 4, 5, 6, 7 pages. They already know what is going to happen, but they're not publishing it in the papers. I will just tell you that, okay, I'll give you my analysis. You need to protect yourself. See, when UAE is saying social distancing, please practice social distancing. I've told you this before. People are still abusing the privileges given. They are going for parties, they are having booze sessions together, they are joking. This is not a joke, guys. See, if you're sick, see these countries, Iran, China, Russia. If someone's sick, they dispose of them. Italy, if people are dying, okay, these countries, Europe and US, they're showing, okay, we are burying these people. But these other countries, like where, freedom of speech and media is controlled, they will just dump you like, dead bodies and set you on fire. They don't want, after you die, it's like these horror movies, after you're contagious, after you get infected, you can infect others even after you're dead. So better than that to just, dispose of the body, set you on fire, make you into ashes, get rid of you. This is not from some Hollywood movie that I'm talking to you about. I was sent a couple of these videos of what is happening in Iran and China, and they say it's the Middle East, but I don't even want to take the name of which country, but because there's no way for me to verify, I'm not sharing this. But the CEOs, I told you this before, the CEOs, the sheikhs, the big guys at the top, they have access to all this information. I just read it out to you. How many people are going to be infected? Please take care of yourself. Please, I request you, take care of yourself, take care of your health. If you're bringing any workers, laborers to clean your house and stuff, keep away from them. It's survival of the fittest. Save yourself, save your families, do your work, mind your own business, don't go out. I spoke to one other CEO. He said, Loy, we are getting, terminate. We're not even terminating people. We're just leaving them there. Let them, if they want to resign, we let them resign. We are not terminating them. So they are putting their papers by themselves. And we don't quote me on this, but if they are employing others, they know that these people desperately want jobs. So they are ready to work for any salary. That's the situation, because they know they go back home, they can't work there. And in fact, you can't even travel now for a couple of months. They will keep this lockdown until people get so fed up. And then as soon as there is that small window of opportunity, people will go back or whatever. But as far as I see it, they will send them back. They will send them back. So whoever is there, okay, can remain. And because of this, I told you, if you don't get a job soon, people will be desperate. They'll be ready to work for even half the salary, even less than that, because they have to survive. I told you this before, I'm telling you this now. You can get a job, get a fucking job fast. Get a job fucking fast. People will work under the table from home without a visa, like how they used to do before. Even on a visit visa, they're working for a company. Even on a tourist visa, they're working. And now they are issuing visas, even if not proper visas, unofficial visas, they are working. So get a job somehow. Forget me. Take the service through somebody else. Get a fucking job. If you have a job, make sure that you don't lose it. But like I said, the number of infections, I just read out the email communication of a CEO. They have already met the top guys. They have already met the CEOs, the sheikhs, the powerful guys. They know how many people are going to be infected. And I read the numbers. Where was that? Where the fuck is that? The document is here. 70% of the global population will have the virus. 70%. 40% of UAE will come in contact with the virus. Death rate will be 0.2%. Globally, 15% will need hospital in the ICU, 5%. In UAE, 1% will need hospitalization very bad, 1% of 9.5 million. So 10% is 900,000, 1% is 90,000. And out of which 25% will need ICU. 6,500 deaths. A total of 3.8 million will contract COVID-19 in UAE. This is not me talking from my ass. I told you this before. I had predicted 1 million, 3.8 million. Wow. Anyway, like I said, up to you whether you want to believe, you don't want to believe. Like I always tell you, please don't believe. I tell you, please don't believe. Do your own homework, do your own research. But see, the bottom line for this video is not to create panic. I want you to be afraid. Yes, I want you to be afraid. But more than afraid, I want you to be safe. I want you to take precaution. Like I said, go to WHO, go to UNICEF, go to those websites, WHO, go to United Nations, World Health Organization, go to that website. Okay? Go to that website, take the actual information. Practice social distancing, practice proper hygiene. Let's work towards making this virus, get controlled. So why? I'll tell you why I'm worried. Because there are people I love, there are people I care about. They are also in UAE. So I wouldn't want someone I love to suffer. And I have a wife, I have a baby, so it's scary. Like, let's be honest. You want to earn a salary. I also want to earn a salary. Not salary. I want to earn income, right? So if you guys are well, I'll have customers. If I have more customers, more happy. So anyway, for those guys who hate me, you can hate me. You can criticize what I do. I don't mind. You're not paying my bills anyway. So anyway, let me know your thoughts. This is what I got. And whomsoever shared this information, thank you so much. I just hope it helps people. I don't know what is your strategy to earn money. More than health. Okay, if we die fast. But more than that, my biggest question is, how are you guys going to survive financially? How are you guys going to make through it? That's the scary part. Anyway, guys, put your comments down below. Share the video with others if you feel it added any value. And please work together to support the UAE government, to support the initiative to control this virus, for all of us to get through it. That's all I can say. So, anyway, take care.